Good morning, Rian Kutsia, Fortis Proactive Defense Solutions. I'm back again with Walther Meyer from Wildmedix. Welcome back, Walt.
Thanks, Rian. Good to be with you again.
We're going to be talking about prolonged casualty care and specifically beyond the so-called golden hour. So I'm going to kick off with asking you, what exactly does this mean if we're talking about prolonged casualty care? What does it mean? What is it exactly?
Yeah, so it's any situation where you are looking after the patient as a first aider or a field medic or whatever. You're looking after the patient for kind of past that first hour, right? So in other words, it's longer than what most first aid courses would prepare you for. And you're now in a situation where time is an issue. Also, in first aid, often you only deal with the initial issue. You don't deal with the subsequent issues that come out after the fact. In prolonged field care, you're now looking at also possibly having to deal with, fallout from the initial incident or additional things that come up with a patient. You may have to deal with things like infections and so forth, which normally is not an issue in a standard first aid situation. You try and do what you can to prevent infection, but it's not your problem normally in a situation like this that, infection as an example may now become an issue, or maybe it's a sick person that you're looking after. So you may do some sort of more nursing care things. So if you think about, let's say, a guy who cannot stand up and go to the bathroom, and you're looking after him for 3 or 4 days, now you have a situation. What do you do with that? Because you've got to keep that patient clean. You've got to keep things sanitary. Plus, you have to look after the injury and the fallout from the injury or the illness, whatever. So it's things like that. So it's basically, it's a unusually long period that you're looking after the patient in less than ideal situation.
So expanding on that, what would you say are the most critical or vital signs or indicators that you need to monitor when caring for a casualty over a prolonged period of time, and keeping in mind under the situation that we're discussing you've got minimum equipment?
Yeah, that's very difficult because a lot of the vital signs monitoring requires equipment, especially if you want to be precise. So the things to keep an eye on, always the first one is look at what we call the level of consciousness of the patient. So the bottom line, what does that mean? It means talk to your patient, ask them how they feel, ask them if they're feeling better or worse, okay, and see how they respond to you as well. So the basic check is you want to see if they're alert, if they can speak back clearly to you, if they can answer questions sensibly and so on, or if there's a degradation in that, right? So if a guy he can answer you, but he's clearly confused, then he's not fully alert, right? So he's alert, but he's confused. And it goes kind of down from there, okay? So you want to have your level of consciousness either improving consistently, or you want it stable. If it's decreasing, you've got a problem. The other thing in long-term field care, which you can have a look at, is the temperature. Now, obviously, once again, if you want to be precise with the temperature of a patient, you require something to read it with some sort of a thermometer or whatever. But without a thermometer, the look of the patient, the look of the feel of the skin, what do they feel like under the arms, in the groin, and so forth? What is the temperature like? And if the patient is alert, ask them, do you feel cold? Do you feel feverish, and so forth? We often see in training that people forget to speak to the patient. They want to do everything, but they never ask the patient a single question. Okay, you have to talk to the patient, and he or she can tell you what is going on with him.
Even if you're very introverted by nature, you have to talk to the patient.
Yeah, exactly. And that's often the problem is the more introverted guys, they don't want to talk to the patient. But your other things that you can monitor quite easily is things like the pulse rate, the respiratory rate you can count, and so on. And you want those things to be in the normal ranges. So you also need to understand the ranges and so on. And you want them to remain stable in the normal ranges, right? If it starts fluctuating a lot, or it starts getting too low or too high, those are all bad signs, and those are all things that you can fairly easily monitor without equipment. When it comes to, obviously, blood pressure is a good indicator, but you require equipment to be precise with that. Without equipment, what you really want to achieve is that if you take a pulse over here on the patient, okay, the radial pulse, in other words, the pulse is furthest away from the heart. So your pulse on your wrist, the pulses on the feet, if you can feel those, it generally means the blood pressure is strong enough or high enough. So that's a simple indicator. It's not precise, but it shows you that the patient is perfusing, and it's a simple check that you can do.
Okay. Infection. How can it be? I mean, we know infection over time, before modern medicine has killed so many people. People that would have survived with modern medicine. But, you know, I suppose mankind had to get there first. How can it be prevented and managed if you're looking at open wounds? And again, you don't have access to a hospital. You're not going to get there. We're now beyond this golden hour, and this is something that, as you mentioned, we have to now start attending to.
Yeah, I think you know, obviously the extent of the injury is quite important, and how it happened. The trick with infection control and wounds is wash. You know, put a lot of water through there. Use the use of normal soap is fine if you don't have anything else. Be careful of using corrosive soaps and so forth. So things like detergents, you know, so if you've got a bottle of Handy Andy or something like that, you're going to have to be pretty damn careful of cleaning wounds or things like that. Then you know, there are also other things that you can clean wounds with, like clear alcohols and so forth. It's not necessarily pleasant for the patient, though. Some of those products they sting a little bit, right? But yeah, it's wash the wound, soap and water. If there are bone ends or things like that that are protruding, you want to get those covered, ideally with a sterile or close to sterile type dressing. And you want to change those dressings regularly, every sort of 12 to 24 hours. You want to change the dressings. If something happens to the patient, let's say you are moving the patient, or you are assisting them to walk out or something like that, if, you know, over a few days, if they get sweaty or dirty or wet or anything like that, then you have to change those dressings again. So you may end up in a situation where you require more dressings than you think, or you may have to start improvising dressings for that if you don't have enough commercial dressings with you. Yeah, and then if you've got it available, common antiseptics like Dettol, Savlon, and those types of things, they work quite well. And then you can also do salt water, right? So you can make a salt water solution, use that for wound cleaning. It's quite effective. You know, so yeah, there are a few things like that you can apply, which are not necessarily super expensive or super fancy. It's often things that you find in houses or in first aid kits and so on.
In cowboy movies, you often see the guy grabbing a bottle of whiskey and pouring out the whiskey over the wound. Is that doable?
Well, you could, but you've got to be careful of what it is that you're using. So generally, you want a clear spirit. So that's why something like whiskey would be better. If you start using things with super high sugar content and so forth, you know, you have other complications. So normally the thing is, if you're going to use that, you would want a clear spirit. So your whiskey or what, like vodka, something like that. You know, that's a clear liquid.
I am tempted to ask if one should use single malt or blend, but I'm not going to. I'm going to stop myself.
The fancier the whiskey is, the less likely you are to pour it over the guy, right? And rather use it for your nerves.
Flowing from the infection management naturally would probably go along with pain management. How do you handle pain management in situations like this over long hours or even days and without any real evacuation plans in place, and there's, you've maybe got Disprints and Bernardos. You don't have the proper pain meds that they would give you in an emergency room.
Yeah, it's a difficult one, Rian. I think when it comes to medications, even the common and over-the-counter ones, it's important that before you use them, you know a little bit about them. I would say probably the safest ones that people normally have at home would be your paracetamol. So that's like Bernardo, that type of tablet, or anti-inflammatories like ibuprofen. Okay, both ibuprofen and paracetamol, both they're kind of low-risk medications, but one has to rule out things like known allergies and so forth. Okay, so you can't just shove it into a patient. Also, I mean, we're talking about a disastrous type situation here, right? So it's not a situation where you can speak to a doctor and ask the doctor for permission, et cetera, or get advice. So ideally, you want the patient to take the medication themselves, of course, not something that you shove into them, okay? When it comes to your aspirin tablets, or your Disprin and Grandpa and all those things, you've got to be quite careful, because if the patient's injured, the aspirin will actually interfere with the blood clotting mechanism. So it may actually make bleeding worse, and especially if you're suspecting any sort of internal bleeding. So I would avoid aspirin for that. Rather stick to your paracetamol and ibuprofen and rule out contraindications. I think people tend to underestimate paracetamol for pain killing in that situation. I think the thing with it is that it's going to take at least an hour to start working if the person takes it orally, like they swallow the tablet. You get paracetamol in an IV solution, which you can give intravenous and so on, but of course that requires additional equipment and skills. So in terms of what most people have around the house or in the bucket cubby or something, it's normally a Bernardo tablet. So reasonably safe, but there are some contraindications, so people need to make themselves aware of these things before they just utilize it.
Okay. Well, last but not least, for people working in remote areas, I mean, farmers and wildlife guides, etc. There's so many, even if people hiking or overlanding. What would you say is the most important training or mindset shift that they need to adopt in order to be much better prepared for these type of emergencies? We're not talking about getting a headache.
Yeah, I think in terms of a mindset shift, it's definitely understanding the seriousness of an injury in that, or an illness in that environment. So people sometimes don't connect the seriousness and the environment, if you understand what I'm saying. So they think that, okay, if I fall on my driveway and I break my arm versus I fall on a 3-day hike on day 2 and I break my arm, I'm in a whole different world now. In terms of management, outcomes, rescue, comfort, all of those things. So that's the one mindset shift. The other mindset shift is this idea of, oh, I'll just wait for the helicopter. I'm just waiting for the cavalry. I'm outsourcing my problem to somebody else. And obviously you see that in the urban environment as well, but I think it's something that washes over from the urban environment, this idea of, oh no, but Big Brother will intervene and come and save me and so forth. I think the thing is just count on the fact that there is nobody coming to save you, and you need to do something about this. Even the evacuation, it might not be possible that you get evacuated by a helicopter or so on. You may have to walk out or be carried out. How do I deal with that? And it's a big shift for people to make that thing and go, okay, well, there is no, Big Brother coming to save me. So You know, what do I do? And then the other thing is, like, even if Big Brother is coming to save you, then it takes time to activate that, right? So somebody may have to walk out. So if you're on that 3-day hike on day 2, one of your friends may have to walk out, which is going to take him at least a day to walk back to a point where you can make a phone call. Then it's night, then the helicopter doesn't fly, it'll only come tomorrow, etc., etc. Right? So it's a whole different world from being at home in a situation where things are normal and you can get help reasonably fast. Yeah, and then the level of training that you actually need for it and the level of knowledge is much higher than people think. You often get people say, oh, I did a level 1 first aid course. The worst is when they tell you they did a level 1 first aid course in 45 minutes. That is, what does that prepare you for? Exactly nothing. Okay. So your more comprehensive level 1, sure, if it's properly done over 3 days or whatever, then it's, you've got a foundational training and things, but it's not going to help you with the smaller, more intricate things. So yeah, the further away you travel, the further away you work or play, the higher the level of training and the commitment to that training. So, it's something that you have to refresh, keep going at it. And we see that regularly. I've been doing training for over 20 years. And we've got so many guys who come back, for the same course. So you'll have some guys will come long before the expiry date on the certificate. They'll come every 2 years or something like that. Come and redo the course. And eventually, they almost become part of the furniture. And it's the guys especially the guys who work outdoors regularly, they realize what the risk is. They take it way more seriously than your weekend warrior tend to do. And then also the other thing is what we definitely see in the Cape specifically, because you don't have to travel very far to get into the wilderness. Table Mountain as an example, a guy thinks, oh no, on Table Mountain I'm just above the city. Okay, so I'll quickly get help because it's just and yeah, I mean it's not that quick when you need it.
That's a very big mountain, and it's very high actually. I suppose in European terms not, but in our terms, that is a big mountain. And I mean, how regularly don't you hear about people getting into trouble on Table Mountain?
Regularly, I mean, if you look at the rescue statistics and stuff for Table Mountain, it's more than anywhere else by a long shot. Okay, so it's very busy, and but it's also a lot of it has got to do with people underestimating the environment because of the proximity of the city or the suburban areas, and I mean, people think, it's just there. It's not a big deal. It's a serious mountain, a serious wilderness area, and it's also it's a lot further. If you think from the kind of the city side of Table Mountain, all the way to Cape Point, that's somewhere between 80 and 90 kilometers of mountain. Right, so it's a long way.
Yeah, you don't necessarily think about it that way. Walt, unless you've got something else to add, that's it from me.
Yeah, no, thanks, Rian. That's a thing to prolong field care, something that's often neglected. So I'm glad we could just mention it and talk a bit about it, and for people to wake up to that situation and wake up to the idea that there isn't necessarily a magical helicopter appearing, or there isn't necessarily a quick access to a hospital. Yeah, very important to wake up to that.
So I will be displaying the Wildmedix details on the screen for the duration of the video. Please contact Walther, speak to them, arrange training with him. It's definitely some of the best training you can hope to find, so it'll be worth your while. If you're interested in anything of the lone operator in terms of training, there'll be a link in the description below. Check that out. Stop the Bleed is actually a full day module on the lone operator course, the one that stretches over 12 modules over a year. And we always get, and it's done by Walt, and we always get very good feedback from students who've done that one. So, Walt knows what he's doing. He's been around the block a couple of times. As always, like that video, and subscribe to the channel and smash that bell icon for us so that you can get notifications of our new videos. This will also go up on Spotify on our podcast called Quick Shots. So you can find it there or on YouTube. Well, that's it. Thank you so much for joining me on your Sunday. I appreciate your time and your skill as always. Thank you for sharing it with us.
Thank you, Rian. Thanks for having me.